Hello, well done on making it to the final week of the Supercharge Your Gut Challenge. My name is Chantel. I'm a nutritionist at CBHS with a special interest in gut health. So today I'll be showing you an abdominal massage technique which was created by Dr. Megan Rossi. She's a dietitian and the author of Eat Yourself Healthy. Now, please note that if you are pregnant, have inflammatory bowel disease, you've had abdominal surgery or spinal issues or any other concerns in that area, please speak to your GP and get the okay before doing this. So this abdominal massage can help relieve constipation and bloating, digestive discomfort, and it can also help move through trapped gas. Now, completing this technique will take about 10 minutes if you complete it in full. And if you do this every day for 8 weeks, it can help improve constipation symptoms. However, if you cannot commit to a full 10 minutes every day for 8 weeks, don't worry. You can take some of the moves that feel good for you and you can use them whenever symptoms arise. So do what works for you and leave what doesn't. Now, before we get started, I'm just going to give you a little bit of a brief overview of the digestive organs, just so you know what you're pressing on and why. So first of all, we have the stomach that sits in the upper left region of the digestive system, just below your ribs. From the stomach, we go to the small intestine. Now, this is a long tube situated within the central cavity of your abdomen. Then we go from the small intestine to the large intestine. The large intestine runs up the right of your body, across the top of the abdomen and down the left, and then kind of into the groin to the end of the colon. So you can do this sitting or lying down, and if you're in the comfort of your own home by yourself, of course, doing skin to skin, and you can use a massage oil as well to help you massage the areas a little bit better. I'm just doing this standing up today to demonstrate so you can see what I'm doing. Okay, so step one, you're going to take your hands and you're just going to place them on the lower part of your abdomen, and we're just going to press up 3 times slowly. And we're just doing this to help bring in some blood flow into the area. So step one, nice and simple. Step two, we're going to take our hands around to the back and we're just going to move them from the back to the center and down, and just do that 10 times. And as you do that, just taking notice of any tenderness, any discomfort, or any bloating that you might feel. And just using the palms of your hands through to the tips of your fingers to press down. This is just helping move blood flow in through the small intestine. I've got 3 more left. All right, so once you've completed that step, we move on to step 3. Step 3 can be a little bit complicated, but once you have a little bit of practice, you'll get into a bit of a rhythm. So you take your right hand and you're going to move it up the right side and across the top of the abdomen, like an upside down L. Now, as you do that, you're going to take your left hand and move it down the left side and down through the groin, following the end of the colon. So you're kind of doing hand movements in the opposite direction. So when you're lying down, you'll find that it is easier to press on these because your abdominal muscles can be a little bit more relaxed. And what we're doing here is we're just helping to stimulate those muscle contractions that are called peristalsis. That is the wave-like contractions that help move food and gas through the digestive system. All right, so when you've done that for 2 minutes, so you can pause here and complete your 2 minutes, and then we move on to step 4. Okay, in step 4, we're going to be massaging upwards on the right side and downwards on the left side. And what we're doing is we're encouraging that movement of trapped gas through and out of the digestive system. So you can press using your fingers. It helps you press in a little bit more, moving upward motions on that large intestine. When you've done about a minute there, you move to the other side using your left hand and just moving downward on the large intestine. Remember to breathe as you do this as well. And you're going to complete that for 2 minutes. Now, you have to complete step 4 again, so the upward motion that we just did and the downward motion for another 2 minutes, and then you complete step 3, which was this movement and this movement for another 2 minutes. So once you've completed those again, you can move on to step 5. Now, step 5 is easy. All you have to do is take your hands open, moving them across 10 times. So we're moving the opposite way that we were before. So we're moving from the left to the right this time. Again, just encouraging that blood flow through all parts of the digestive system. All right, now it's time for the last step. And this one can also be done on its own to help relieve trapped gas in acute situations. So all we're going to do for step 6 is take our hand and press in 6 different parts of the large intestine to move the trapped gas through that large intestine out through the colon. And hopefully you're at home on your own in the privacy of your own home. You can let that gas out when you're moving it out. It's okay, it's completely normal. So no need to be worried about that. So all you have to do is push, press, and then you kind of wiggle as you do it. And so I'm doing 6 parts of the large intestine, but if you have an area where you can feel trapped gas, sometimes it can happen in the lower abdomen, you can feel free to change the spot where you do it. Do what feels right for you. And you just press and kind of jiggle, and that will help move the trapped gas along. So there you have it. You've completed your gut health massage. So done regularly, this can help relieve constipation and bloating. But don't forget, you can use the last step on its own to move trapped gas out of the digestive system. And you can take parts of this practice that you need anytime to help relieve digestive discomfort.